Welcome, class. Welcome, welcome. As you recall, in one of our recent sessions, we discussed substance use, abuse, and dependence, and I made a joke that our IT/media criticism department took exception to. Well, there's no accounting for taste, but perhaps my sense of humor is not as infectious as I thought. Ugh, tough crowd. Now, who has questions about substance abuse? Yes.
In that session you mentioned, we discussed the 11 criteria describing substance use, abuse, or dependence. Is there a single criterion that is required to diagnose a substance use disorder?
Excellent question. No, one single specific criterion will not do for diagnosing these issues, and neither tolerance nor withdrawal is necessary to diagnose a substance use disorder. The threshold for diagnosis is set at 2 or more criteria of the 11 you see on the following screens. Jerome, can you... You must be able to document at least 2 of the 11 in order to support one of the diagnoses. The more criteria you are able to document, the higher the severity. The diagnosis severity breakdown is as follows, with mild being the existence of 2 to 3 symptoms, moderate with 4 to 5 symptoms, or severe with a patient exhibiting 6 or more symptoms.
Are symptoms of tolerance and withdrawal from prescribed medications considered substance abuse disorder?
Only if the medication is being used not as directed. Tolerance and withdrawal of prescribed medications taken as directed is not substance use disorder. As we discussed in the prior session on this topic, patients that are taking their medications as directed and exactly as prescribed, for the length of time and in the amount prescribed, even though we know they may be physiologically dependent upon the medication, this is not to be called use, abuse, or dependence. Remember, according to the DSM-5, craving and the behaviors due to craving are the underlying factor here.
Yes. Can you talk a little bit about the stages of remission for substance abuse?
Certainly. Early remission for a DSM-5 substance use disorder is defined as at least 3 months, but less than 12 months without meeting any of the 11 criteria, except for craving, which we believe is constant. Sustained remission is defined as over 12 months. Now, for further clarification, you can always feel free to contact your compliance, education, or coding department whenever you have a question about documentation. Because, as you know, the better your documentation, the more your office will run like clockwork. Stick to your day job, Moriarty.
These links will take you to the ICD-10 CM Guidelines, the 2017 crosswalk of codes to HCC and RxHCC categories, and to the most current listing of ICD-10 CM codes on the CMS site. Please feel free to muck about in them for clarification and further edification.